Well, I think as an independent expert in this field, I mean, I do feel very positive about the potential for anti-cancer viruses in a range of diseases, but including NETs, neuroendocrine tumours as well. It's very difficult to know because no trials have been started as yet in that particular disease, but we do know from preclinical work in the laboratory that some of these viruses look to have very promising anti-cancer effects. So what the Swedish researchers have shown in their laboratory at this stage is that by taking an anti-cancer virus called an adenovirus, they have genetically modified that virus to particularly target and to attack the cancer cells. And they've done that both by making the virus more specific for attaching to the cancer cell and also more specific for replicating and destroying the cancer cell itself while sparing normal cells around it. One of the big problems with cancer is that the immune system is relatively blind to it, and cancers do a lot of different things to hide from the immune system. However, your immune system is extremely good at recognizing viruses. So if you can put a virus within a cancer, your immune system will wake up and potentially attack that cancer, which it would otherwise ignore. So these viruses definitely do work in part by stimulating your own immune system to attack your cancer. This particular approach is promising for neuroendocrine tumours, but one of the great potential benefits of these anti-cancer viruses is they could be applied to indeed any type of cancer. Nothing is necessarily excluded. Certainly one of the problems with neuroendocrine tumours is they are relatively resistant to some of the standard types of treatment that we have, such as chemotherapy. Therefore, there's no doubt that there are new treatments needed, and I think potentially viruses such as this, which have been developed and shown to be promising in some of the early models, are now very ready to be tested in patients. I think a fundraising campaign like this one is extremely important. This is an area of research and progress that can be quite difficult to fund by other means. Some of the big funding agencies, or indeed the pharmaceutical companies, will not necessarily see something like neuroendocrine tumours or viral therapies as top of their priority list in terms of trying to take treatments from the laboratory into the clinic and forward into patient benefit. So a fundraising campaign like this could be absolutely critical in helping to get research from the bench to the bedside and actually translate scientific findings into real help for patients.